If you go to a doctor's office and the doctor says, I guess you could try this keto diet, this low carb diet. It's pretty hard to stick to. You really have to give up a lot of your carbs, but I guess you could try it. What's the chance that that person is going to succeed versus someone who says, oh yeah, if you want to reverse your diabetes, reduce your carbohydrates, go on a low carb or keto diet, make sure you're getting adequate protein. And there are people who have done this for decades and it works perfectly well. And so give it a try and see how you can do. Who's more likely to be in the mental space to succeed with those two different encounters?
Hey guys, today our guest is one of the most unique cardiologists you have ever encountered. He is Dr. Bret Scher. Dr. Bret Scher is a top-notch cardiologist who has been treating patients with low-carb diets for over 8 years. Dr. Bret is the full-time medical director for dietdoctor.com, which is the #1 low-carb and keto website in the world. And Dr. Bret also hosts the Diet Doctor podcast. Dr. Bret is also the author of Your Best Health Ever, which is a simplified guide to wellness, and also has a blog and website called lowcarbcardiologist.com. Dr. Bret's real goal is to inspire individuals just like you to promote your own health by adopting healthy lifestyle habits without prescriptions. I highly believe that Dr. Bret is on a mission to change the world for the better. I'm very happy to invite Dr. Bret Scher to the show. Thanks, Bret, for coming to the show.
My pleasure, BNS. Thanks for having me on today.
Yeah. Bret, before we go into the interview, can you share where can people connect with you?
Sure. Yeah. The best way to connect with me now is through dietdoctor.com. That's where I'm the medical director. We're the leading website in the world for low carb and keto information and healthy weight loss. Whoops. Sorry about that. Healthy weight loss information as well. So that's where most of my work is done now. For people in the United States who want to see me as a patient, low carb cardiologist is the best place to go. But unfortunately, I am limited to seeing people in the United States through that service. So yeah, dietdoctor.com, and then my podcast, the Diet Doctor podcast.
Thank you so much, Bret. Bret, my first question is keto or low carb diet heart healthy?
Yeah, it's a great question. Well, the answer is yes, but the more important question is, what is a heart healthy diet? And I think that's where we really sort of have a misunderstanding of what that means. Because if your focus is completely on, does your diet, do your foods lower your LDL cholesterol? If that is the only definition of a heart healthy diet, then I guess for the most part, a keto diet is not heart healthy. But I would argue that that is a complete misrepresentation of what a heart healthy diet is. And a heart healthy diet is one that lowers your overall cardiovascular risk factors. Well, those cardiovascular risk factors are type 2 diabetes, metabolic syndrome, hyperinsulinemia, visceral obesity, high blood pressure, low HDL, high triglycerides, size and density of your LDL particles, inflammatory response. All of those components are what make up cardiovascular risk. So a heart healthy diet would be one that can beneficially change the majority of those factors. And that's exactly what low carb and keto diets do. They are probably the best diet for improving blood sugar control, helping with visceral adiposity and abdominal fat, helping improve HDL and triglycerides, helping improve the size and density of your LDL cholesterol. I mean, they are a very powerful intervention for that metabolic benefits and those cardiovascular benefits. And there are studies, there are great studies to prove this. When you compare low carb diet versus low fat diet, all of those parameters change more on a low carb, generally higher protein diet than on a low fat diet. And when you calculate someone's 10-year cardiovascular risk, which is just this formula that your doctor kind of puts all your information in, and your risk goes down for the majority of people starting a low carb or keto diet. So based on those factors, I say yes, that a low carb keto diet can be and is a heart healthy diet.
Thank you, Bret. Bret, why do cardiologists still suggest that polyunsaturated fatty acids are best for heart health?
Yeah, because exactly that definition focusing on LDL, because polyunsaturated fatty acids can lower LDL to a small degree. So if your endpoint is what happens to your LDL and that defines cardiovascular health, then you are setting up the perfect equation to say polyunsaturated fatty acids are heart healthy. But if you also look at oxidation and inflammation, and if you look at the few randomized controlled trials that have been published, going back to the Sydney Diet Heart Study and the Minnesota Coronary Experiment, those were studies that were randomized controlled trials that compared a high PUFA diet versus a high sort of more saturated fat diet. And those did not show benefit to the PUFA diet. In fact, one of them showed worsening with the PUFA diet. Now, there are lots of caveats about these studies. No study is perfect, but using that as your definition, you would say there's certainly nothing special about the high PUFA diet that would be heart healthy. But again, if you're defining it just as LDL, all right, then you have your answer. So it's in a way you can sort of set up the question to give yourself the answer you want, I guess. That's one way to look at it.
Thank you, Bret. Bret, how to change doctors' mindset towards a low-carb diet?
Yeah, it's a great question. How to change a doctor's perception. So there are two ways to think about this. One is if you're the patient talking to your doctor and you just want to get engagement from your doctor to help you with this, that's one question. And the other is how to sort of frame the education as a whole to reach the whole world of doctors. So let's take the first one. If you're working with a doctor and you want to try low carb, or you already are low carb and you want to engage your doctor to work with you, one thing is the terminology you use, right? If you say I'm on a keto diet, right away the guards go up. Or this term keto is literally a 4-letter word for many doctors and healthcare providers because of what they've been taught for decades and decades about fat is bad, saturated fat is bad. So for one, I recommend if you have a sort of a skeptical doctor, don't use the word keto. Just say, yeah, I want to eat whole foods and limit the junk food and limit the carbohydrates. And is that okay? Can you help me with that? And can you help make sure I'm engage the doctor to work with you? Can you help me make sure I'm improving my health, that my metabolic parameters are improving? I want to lose weight, improve my blood pressure, and improve metabolic disease. Any doctor in the world should be absolutely, let's do that. I'm on board with that. But if you use the word keto, you're going to get an emotional response rather than an intellectual response. So I think that's one bit of advice I can give. Now, in terms of educating the world of physicians, one is just more studies, which are coming, and we have so many studies already showing low carb diets work. But another is having a uniform definition of what low carb means, because we really get hurt when groups like the Harvard School of Public Health publish studies saying low carb diets are dangerous and lead to premature death, when they define low carb as 40% of your calories from carbohydrates. That's not low carb. So allowing that terminology, allowing that definition in the medical literature really hurts the concept of low carb diets, because a lot of people don't spend the time to look at the details. And that's part of what I really try and do at Diet Doctor, to make this more widely available knowledge so people understand the difference. So one is, if we can really have a more universal definition of low carb. The second, though, is making sure our message is, look, there's no one diet for everybody. That's what sort of got us into this mess in the first place, saying this low-fat diet, low calories is what works for everybody. Well, no, there's no one diet for everybody. So being very clear, that doesn't mean you have to, but really letting doctors sort of understand, okay, if I have someone with type 2 diabetes who's struggling with their lifestyle, or someone who has just so many cravings and is hungry all the time and can't follow the diet I'm giving them, then maybe those are the people that you want to try a low carb diet and then start getting experience with it. So making sure the message is refined so the doctors and clinicians know which is the group most likely to benefit. And then as their personal experience grows, they can start trying it in more patients. And then the third thing I'll add to that is being clear about what a low carb diet is, because for some people, low carb or keto, right away they see bacon wrapped steaks soaked in butter for every meal of the day. And why that works great for some people, that's not what a keto diet by definition is. You can have a vegan or a vegetarian keto diet. You can have a Mediterranean keto diet. You have tons of fiber-rich vegetables on a keto diet. So it's helping clinicians understand this broader concept of what a low-carb or keto diet is.
Yes, Brett, thank you. And recently, when I interviewed Nina Teicholz, she also said that because of lack of uniformity in low carb definition, like so many studies got rejected in the like dietary committee guideline or something. So yeah. And Brett, my next question is: does eating fat make us fat?
So there's nothing special about eating fat to make you fat, right? That fat is a calorie. So you can get fat by eating too much fat. It's certainly possible to do if you're eating 5,000 calories of fat, more than your body needs, you can put on weight. But if you're eating the appropriate amount of calories for you and doing it in a way that is not increasing your hunger, but rather decreasing your hunger, so plenty of essential nutrition and protein, and 60 to 70% of your calories from fat, that does not make you fat. So there's this concept that because it's fat, our body is going to take it in and immediately store it as fat, because fat equals fat. But that is way too simplistic. Our body is a much more complicated machine. And if you're burning fat for fuel, for energy, then you're going to burn all that fat that you need rather than store it. And interestingly, although it's a little more complicated to take in carbohydrates and store them at fat, that's more likely to happen than fat being stored at fat when you are burning fat for fuel. And that's when your body switches its engine from the carbohydrate and glucose burner to the fat burner, which is, for weight loss, definitely a more effective place to be. So the simple answer is no. Just because you're eating fat does not mean you're getting fat, but it's certainly possible to eat too much fat and gain fat. But it's kind of challenging to do. It's so easy to just go to town on carbohydrates and simple carbohydrates and just eat a ton of those. It's harder to overeat protein, and it's harder to overeat fat. Possible for sure, but much more difficult. And that's why that's a big part of how a low carb diet works well, because especially if it's a higher protein diet, anywhere from the 20 to 40% protein range, you're going to feel pretty full. And then you add fat for taste and enjoyment, and that's going to increase your fullness with those calories. And then you're not going to want to overeat. It's going to be difficult to overeat the benefits of this diet, for sure.
Thank you, Brett. Brett, what are some tips for the people who want to start a low carb diet?
Yeah, so the tips are, first, understand why you're doing it. What are your goals? Because if your only goal is weight on a scale, okay, that's one thing. But I think it's important to understand this concept of healthy weight loss and non-scale victories. And that's, weight is important. There's no question weight is important, and you can feel better at a lower weight. It can help with your bones. It can help with your multiple different health issues. But also, what is your blood sugar doing? What is your insulin level doing? What is your inflammation doing? What is your energy level doing? What's your thought process doing? How often are you thinking about food during the day? Do you have energy spikes and crashes? I mean, there's so many other factors that come into what is sort of a healthy lifestyle, healthy weight loss, and how do you want to live your life? So I would encourage people to think more about all of those goals rather than just, what is your weight? And the other tips are, decide how quickly you want to do it. Some people are the people who like to just jump in and go to 20 grams of carbs per day, get into ketosis. You're probably going to get some aspect of the keto flu where you start to feel kind of run down and tired and fatigued. But it usually only lasts a week or two, and you can get over it with hydration and electrolyte supplementation. Or are you the type of person who wants to just sort of gradually work your way down? So we have a guide on our website at Diet Doctor called 6 Steps Down Carb Mountain. Basically for the people who want to go a little more gradual. You get rid of the sugar sweetened beverages, you get rid of the sweets and the refined carbohydrates, and you slowly sort of inch your way down the carb mountain, getting rid of more and more carbs as you start to transition to the low carb diet. So first is trying to figure out, which type of person are you? Are you the person who wants to do it more gradually, or the person who wants to jump into it? Another thing though is, if you have type 2 diabetes or even type 1 diabetes, if you're on glucose lowering medications, you do have to be careful, because this is where the diet is, its effectiveness can be a problem because it's so good at controlling blood sugar and lowering blood sugar that if you're also taking medications to lower your blood sugar, you're at risk of a dangerously low blood sugar. So in that setting, it really is important to work with a healthcare practitioner who can help you safely lower your blood sugar medications when you start this diet. So that is one important caveat. Other tips are to find the foods that you love to eat, because anybody who feels like they are struggling or giving things up or sacrificing, right away you're decreasing your chance for long-term success. So find the foods you love to eat. So if that means pizza, then find a low-carb pizza. If that means, you need a dessert every night, find a low-carb dessert every night. Now, eventually, you might be able to sort of wean your way off of these things, but I think it's certainly in the beginning, making it feel like you're not making huge sacrifices is very important. And that's one of the great things about our website at Diet Doctor. We have over 1,000 recipes at Diet Doctor, and a number of our most popular recipes are our keto pizzas, our keto bread. They're these substitute foods that people want, certainly in the beginning, to not feel like they have to sacrifice. And that's absolutely right. I mean, the best chance of long-term success is a diet that you love and you enjoy the foods and you look forward to. Yeah, because we have to be honest that there is definitely something pleasurable for most people about eating.
Thank you, Bret. Bret, how does one know that they are at risk of heart disease?
How does someone know they're at risk for heart disease? Well, that's there are multiple things that go into that. And first and foremost is family history. If you have a strong family history of people having heart disease in their 50s and 60s, then you just, probably have a bad hand that was dealt to you. Now, it doesn't mean it's a foregone conclusion. There are obviously things you can do in your life to reduce that risk, but that's first and foremost. What is your family history? Next is, have you smoked in your life, right? If you have a history of tobacco smoking or being exposed to lots of tobacco smoke, you are at high risk. Even if you've quit, your risk is still higher than the average person. So whether you have a history of smoking. And then what is your metabolic health like, right? And that's one thing that I think is not focused on enough. But I just wrote a news post at Diet Doctor, I don't know, maybe a month ago or a few weeks ago, about this study that came out looking at women in their 50s and what was the biggest predictor of cardiovascular risk moving forward, over the course of the next 20 years. And it was type 2 diabetes and measures of metabolic dysfunction, I guess you could say, metabolic syndrome, and insulin resistance. Those were the highest predictors of increased cardiovascular risk. So if you have those predictors, if you have a, elevated abdominal waist circumference, if your blood pressure is high, if your triglycerides are high, if your HDL is low, if your blood sugar is high, if you have high insulin, those are all markers of increased cardiovascular risk. And then LDL is certainly part of this. I think we give far too much attention to LDL, but LDL is part of it, especially if it's LDL in the setting of chronic inflammation, of small dense LDL, of metabolic dysfunction. Then you want to make sure your LDL is not elevated, and you want to try and reverse all those other factors. So those are some of the big factors that come into increasing cardiovascular risk.
Thank you so much, Bret. Bret, what medical tests do you suggest to the people who want to start the low-carb diet?
Okay. Yeah. Good question. So, well, one is I like people to get body composition measurements. So, if you can go get a DEXA scan, or we have these things called bod pods, or just a bioimpedance scale, some sort of measurement of body composition, so you can follow that moving forward. So you're not just looking at the weight on a scale, but you're looking at your visceral fat, your abdominal fat, and your lean muscle, because healthy weight loss involves, losing mostly fat. And you'll probably lose some lean muscle if you're losing weight, but you want to minimize that or even try and increase it if you can. But in terms of lab tests, knowing what your baseline lipid panel is, so your HDL, your triglycerides, and your LDL, even better if you can get an advanced lipid profile, which shows you the size and density of your LDL particles. It can measure your Lp(a). You can get lipid inflammatory markers. Those are sort of the bonus ones, I would say, that sometimes are hard to get, but definitely a baseline lipid panel. And what your blood sugar is, not just your fasting blood sugar, but if you can also follow your blood sugar during the day. I'm a huge fan of CGMs, continuous glucose monitors, simple little device you put on the back of your arm. I had an interview on my podcast with Dr. Casey Means all about CGMs. I recommend those because What's more important than just your fasting blood sugar is what your blood sugar is doing throughout the day, how it responds to food, knowing exactly which foods trigger your blood sugar in different ways and which combinations of foods. So I think that's important. If you can't get that, though, a hemoglobin A1C is a blood test that gives you your average blood sugar for the past 3 months, much better than just a spot check of your glucose. Knowing what your insulin is also very helpful. Again, it's hard to get insulin throughout the day. You can't get a home monitor. You have to get it in a lab. But knowing what your fasting insulin is, if it's really high or really low, it's pretty helpful. Yeah, I mean, there's so many other tests, your inflammatory markers. A high sensitivity CRP is a very good test for that. Knowing what your liver markers are, because there's such a propensity for fatty liver disease. So if you have elevated liver markers, making sure those come down as you progress on your diet. I think those are probably the basics that most people should get. And, what's your kidney function? Everybody should know their baseline kidney function, their baseline white blood cell count and blood level. And those are things you can follow over time too, that aren't quite as much diet related, but those are good for like a basic overall check as you're embarking on any diet.
Thanks, Bret. Bret, can we reverse type 2 diabetes with a low carb diet?
Absolutely. Next question. No, that's something that there should be no debate about anymore. I guess the only debate is how do you define the word reverse? That's the only debate. But there's no question that with a well-formulated low carb or keto diet, you can absolutely get people off their diabetes medicines and lower and normalize their blood sugar readings. Now, is that a cure? No, that's not a cure, because a cure would imply, well, you can go back to eating junk and leading an unhealthy lifestyle and it won't come back. That's what cure implies, and that's not the case at all. Is it remission? Well, yeah, I guess remission is a adequate term there, and probably the most commonly used term now is remission, because there's a chance it could come back if you change your lifestyle, but right now it's not present. So some people like to also call that reversed, because you have in a way reversed it. Your levels are normal now and you're off your medication. So whether you call it remission or reverse, I guess for a lot of people that's a personal preference, but absolutely low carb and a ketogenic diet can improve and normalize blood sugar readings for people with type 2 diabetes and completely eliminate the need for medications. Now, that doesn't mean everybody's going to achieve that, right? Everybody progresses at their own pace and is on their own journey. But, if you can cut your insulin in half, or you can eliminate your insulin but still need oral medications, that's still a huge victory. If you get your A1C from 8 down to 6.8, that's still a huge victory. Now, with continued progress, with looking at other factors, with perseverance, you may continue to do even better. But there's no question that this diet helps people with type 2 diabetes.
Thank you, Bret. Some health experts say that keto or low carb diets work for short term but not long term. What do you say about them?
Yeah, it's a good point. A few articles about this as well. We just wrote about a big meta-analysis that reached those conclusions. And the problem is, again, in how you interpret the studies, because a lot of these studies, they follow this protocol where you're enrolled. The first 3 months, you're on 30 grams of carbs per day. And then you slowly start adding carbs back, because the people running the study feel that you just can't maintain 30 grams of carbs a day. So we want to make this something you can stick to, so you add carbs back. Well, what do you see? Well, their diabetes and weight loss improves dramatically, and then they start adding carbs back and things start resolving back to normal, or back to their baseline, which is not normal. But so the structure of the trial is so important. If you're looking at trials like that, okay, it's not going to work long term. But you look at the trial like what Virta Health did. Now, it's not a randomized trial, but they said, look, we're treating you with a ketogenic diet. We're not going to increase your carbs up to 150, 200 grams, as many of these studies did. We're just keeping you in a ketogenic diet long term. And you see their 1-year data, you see their 2-year data, now their 3-year data, and it's impressive. It continues to work. And most of the studies that keep people at that level can show long-term success. So it's a big confounding variable when you're using these other studies that increase the grams of carbohydrates, which is unfortunate, because it so much depends on the communication, right? If you go to a doctor's office and the doctor says, I guess you could try this keto diet, this low carb diet. It's pretty hard to stick to. You really have to give up a lot of your carbs, but I guess you could try it. What's the chance that that person is going to succeed versus someone who says, oh yeah, if you want to reverse your diabetes, reduce your carbohydrates, go on a low carb or keto diet, make sure you're getting adequate protein. And there are people who have done this for decades and it works perfectly well. And so give it a try and see how you can do. Who's more likely to be in the mental space to succeed with those two different encounters. So I think it's important to recognize when the studies let people add on carbs. The Diet Fits trial is a perfect example. It was a lot of attention around this trial because it was funded by NUSI, NUSI, which is Gary Taubes's venture to really get down to the basics of nutrition science and design great trials in nutrition science. Well, the end result of this trial was there was no difference between the low carb and the low fat group. But again, the low carb group was really only low carb for the first 3 months. By the end of the trial, they were eating over 130 grams of carbohydrates compared to 210 grams in the control group. That's not a big difference, and ended up not being a low carb study. But that's not the media attention it got. So we need to be better at defining these things.
Thank you, Bret. Bret, why do news and media outlets continue to make false claims about low carb diet or keto diet? Like they say that it damages organs, something like that. What are your thoughts on that?
Yeah, that's a great question. And there are a lot of different answers to that. But look, news and media companies now want to get clicks. Yeah, that's their business model, getting clicks and selling ads and what brings in readers. So it's to their benefit to stir up controversy. It's to their benefit to get people circulating posts. And so that's one thing. The other thing is, there are so many people whose careers have been built on saying avoid fat, avoid saturated fat, eat your fruits and vegetables and your healthy whole grains. Careers have been built on that and exist on that, and institutions and funding and large corporations. A lot of people have a vested interest in keeping that message going. So that could also be part of it. And then a lot of it is also misunderstanding of how these studies are, or how the diets are defined in the studies, and a misinterpretation. The prime example is, look, Harvard School of Public Health has a fantastic name, right? It's got the cachet of Harvard, and you should trust things coming out of Harvard. And they have published many studies saying low carbohydrate diets are dangerous and will kill you. But that's because of completely inappropriate definition. But the general public and the general news media doesn't quite understand that, or doesn't want to portray that. So those factors all sort of play in to this problem. And it bothers me. And actually, in India, this was a big story. The very famous young Bollywood star who died of kidney failure, that was blamed on a keto diet. It was just, the story was reported, she died of kidney failure from a keto diet. There was absolutely no evidence that I saw anywhere that a keto diet was related. It was just thrown out there. And there's no evidence in the literature that keto diets are going to harm your kidneys unless you already have advanced kidney disease and are eating high protein. That's a different story. But if you have normal kidneys at baseline, or even mild or moderate kidney disease at baseline, there's absolutely no evidence that a low carb or keto diet is going to harm your kidneys. So, when news media outlets just throw that out there, people just jump on it, and it's dangerous. It's irresponsible. Yeah.
Yes, Bret. Bret, many people fear that eating red meat or eggs increase their TMAO levels, so they tend to avoid them. Can you talk about that?
Yeah, TMAO is also an interesting one, and we have a couple posts on Diet Doctor as well about TMAO. If you're measuring surrogate outcomes, surrogate meaning not the actual outcome you want to measure, meaning heart disease or who lives or dies or whatever, but you're measuring a surrogate outcome, something like LDL cholesterol is a surrogate outcome. So TMAO has risen recently as a surrogate outcome. But the better question is, well, how good of a surrogate outcome is it really? And if you look back at that, one of the main studies in New England Journal of Medicine of people who were in the cath lab, those who had heart disease, those who didn't, and they also measured TMAO levels. if you looked at the highest level compared to the lowest level of TMAO levels, there was a difference in heart disease. The people at the highest level had more. Well, they also were more overweight. They also had more hypertension. They also smoked more. They had less healthy lifestyles. And at any of the intermediate points, you know, the fifth highest level, the fourth, the third, the second, the first, the intermediate levels didn't have the same association. It was only at the extreme. So why am I talking about all this statistic stuff? Well, because it brings the question of, well, was the TMAO really the cause of the heart disease? Or did it just happen to be associated with the unhealthy lifestyle and the patient being unhealthy or less healthy at baseline with all these other things that contributed to heart disease? That question is not known one way or the other. So we cannot assume that TMAO is therefore causative of heart disease. And you know, the other thing is, you know, fish has such a much higher level of TMAO than any other food. Even vegetables can be high in TMAO. So, you know, why the difference? So there are a lot of unanswered questions still about TMAO from a scientific standpoint. So personally, I'm not too convinced by it. And look, if you want to know, not everybody who eats meat raises their TMAO level. If you have a high meat diet that's very low in vegetables, then you're probably a little bit more likely to raise your TMAO. If you have a high meat and high vegetable, which is perfectly compatible with low carb and keto, then you're probably less likely to raise your TMAO. So it's not that meat equals TMAO. And eggs are even more consistent than meat in terms of raising TMAO. So yeah, I would never advise someone to avoid meat or eggs simply because of a TMAO concern.
Thank you, Bret. Bret, many health experts suggest that calorie restriction is the ultimate answer. What do you say about that?
Well, you know, that's really interesting because look, calorie restriction works. There's no question calorie restriction is an effective way to lose weight. But now the next question is it a long-term solution? Is it healthy weight loss? And the answer is it could be, right? So in a way, you want to find the dietary pattern that is going to help you get all the nutrition and protein you need and feel full and not have cravings with the minimum number of ingested calories. So if you can do that, if you can get all of the nutrition you need, all the protein, all the vitamins and minerals, and satisfy your hunger and keep feeding your metabolic rate so you don't lower your metabolic rate, and you can do that at 1,500 calories, then you don't need to eat 2,500 calories, right? And that's going to be your biggest success, your biggest chance of success. That's very different than saying all you have to do is reduce your calories to 1,500 and you're going to lose weight. Because if you reduce your calories to 1,500, but you're not getting enough protein, you're not getting enough nutrients, you're hungry all the time and you've got cravings and you're thinking about food and you're miserable, you are not going to succeed. Or if you lower your calories in a way that also dramatically lowers your basal metabolic rate, so now your body's burning fewer calories, you get in this cycle of needing to lower your calories even further. And then you lower your metabolic rate and you still get in that cycle. So lowering calories works, but it's far from the only component that you need to think about. You need to know how to lower your calories in the best way to avoid all those things that I just said so that you can have healthy weight loss and a long-term solution.
Thank you, Bret. Bret, can we use lifestyle interventions to treat blood pressure issues?
Oh yeah. Can you use lifestyle to treat blood pressure? Absolutely. Absolutely. One of the most effective things a lot of people can do is stress management techniques, whether it's breathing techniques, meditation, mindfulness, you know, getting out for walks, getting in nature, breathing fresh air, whatever is a chronic stress reducer for you is going to help blood pressure. Getting adequate sleep is going to absolutely impact your blood pressure. And then, of course, maintaining a healthy weight, improving your metabolic health is going to help your blood pressure. Low carb diets have been shown to lower blood pressure. Higher protein diets have been shown to lower blood pressure. So absolutely, you can use lifestyle interventions and exercise. Pretty much any type of exercise, whether it's long, steady cardio, whether it's high intensity interval training or resistance training, over the long run has been shown to improve your blood pressure. So just like with blood sugar and metabolic health, with blood pressure, lifestyle is treatments number 1, 2, and 3 for me before considering medications in my mind.
Thank you, Bret. Bret, many people think that keto diets increase uric acid levels, so they tend to avoid them. So, like, can you talk about uric acid?
Yeah, I mean, there's a concern that too much protein can increase uric acid levels. If you have uric acid, okay, that could be an issue. But interestingly, uric acid is also correlated with gout. And aside from the first few weeks on a keto diet, you're more likely to decrease your risk of gout than increase it long term. You can certainly just measure your uric acid. I'm always worried when someone says, oh no, like my LDL might go up or my uric acid might go up. Well, instead of saying might, why don't you just measure it and find out for sure, right? Why deprive yourself of a chance of what could be a successful lifestyle for you simply because you're afraid something might happen when it's an easily measurable thing. So I think that's something that's perfectly easy to measure, but the bigger question is sort of what are the consequences of uric acid? So again, uric acid kidney stones could be one, but most kidney stones are not uric acid. Most are calcium oxalate. It's very rare to have uric acid kidney stones. And then gout's the other thing, but interestingly, long term, it seems like your risk of gout goes down with a low carb or keto diet rather than going up.
Thank you, Bret. Bret, can vegans do a low carb diet?
Yeah, can vegans do a low carb diet? That's one of the beautiful things about low carb diet. Any diet can do it. A carnivore can do it. A vegan can do it. Mediterranean can do it. Vegetarian can do it. Now, it's more, in my mind, is much more challenging for a vegan to do it because vegetarian and vegan sources of protein tend to be higher in carbohydrates. You need to eat more grams because plant proteins tend to be less bioavailable than animal proteins, and they come with more carbohydrates. So it's more challenging, but absolutely can be done. A lot of low carb beans like lupini beans, a lot of soy. So hopefully it's maybe, like a non-GMO organic soy, but it doesn't have to be, right? You choose what you can afford and what you can find, but that can get you your protein. So yeah, absolutely possible, and especially vegetarian. Once you allow dairy and eggs, then it opens up a whole new world. Without dairy and eggs, though, it's still definitely possible.
Thank you, Bret. In fact, I have sent so many vegans to Diet Doctor website. And there is a post that how to do healthy low carb vegan diet in Diet Doctor website.
Our dietitian Francisca Spritzler, she wrote 2 really good guides that I've reviewed. One on a vegan keto or vegan low carb, and one on a vegetarian keto diet. We have those 2 guides, and then we have a number of recipes as well to help achieve that. So yeah, if you're looking for information on how to get started, our website's a great place to go. The guides are all free, available to everybody, and can certainly help you. And importantly, they go through how can you achieve getting enough protein and what supplements do you need to consider, because let's be honest, the vegan diet is not compatible with a healthy life, period, unless you supplement, right? Unless you supplement that, and that's an absolute truth. So you can absolutely do it, but you have to supplement. You have to be careful about it. And so if you choose to do that, just make sure you're doing it smartly with the right supplements and make sure you're getting the right protein. And then absolutely, it can work, and it has worked well for a lot of people.
Yes, Bret, that's the reason why I sent to Diet Doctor, because you mentioned that the following may be missing. That's why you have to supplement. So that's the reason why I sent to Diet Doctor.
Yeah.
So thank you for that. Bret, now we have questions from subscribers. First question is, how to deal with heart palpitations?
Well, and look, I guess I should have started this podcast by saying I can't give any medical advice. In order to get medical advice, you need a full consultation and need to be working with your own private clinician. But heart palpitations is a tough one because they can mean so many different things. On the one hand, it can be just a simple benign PAC, which means premature atrial contraction. On the other extreme, it could be atrial fibrillation or ventricular tachycardia or something like potentially dangerous, and everything in between. So it really depends on, how often you're having them, what they feel like, what other symptoms you're having. There's so much more involved. But to give one specific, sometimes when people go on a low carb diet, they do get palpitations as a potential side effect. And some of that may be from dehydration or electrolyte imbalances. Because when you start a low carb diet, your insulin levels go down, your glucose goes down, your carbohydrates that you take go down, your body starts burning fat for fuel. You have a shift in your electrolytes and you actually lose sodium, you lose excess sodium in the beginning. So you need to replace that sodium. You need to eat more salt, or even sip on pickle juice, or drink bone broth, or seek out higher natural sodium intake to sort of counteract that and hydrate well. So that is one potential side effect. But yeah, otherwise palpitations is so general. It's hard to give an answer on this type of form, unfortunately.
Thank you, Bret. Bret, second question is how to eat low carb diet on a budget.
Yeah, so we've got a post on that too at Diet Doctor. And this is where, the message can really harm some people. If it's like, you have to eat organic vegetables, you have to eat grass-fed meat and pasture-raised eggs, and, all of a sudden the price tag is just ching, 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 ching. No, you don't have to. Look, if you're eating 300 grams of carbohydrates and refined sugars and starches and sodas, and you go to a diet of just eating McDonald's burger patties for your proteins, and just getting the cheapest thing in the grocery store for proteins and veggies, you're going to be way better off than that previous sort of standard Western or standard Americanized diet. So it is absolutely possible to do. And this is where one of the benefits of planning, you go to the grocery store, you see what's on sale. Today, pork chops are on sale. So you buy pork chops. This week, you're eating pork chops. Next week, it's the ground beef that's on sale. So next week, you're eating the ground beef. And the vegetables tend to hopefully not be that expensive, especially the fibrous above ground vegetables. And you can look for inexpensive sources of fat, whether it's, butter or olive oils. Those usually are pretty affordable for most people. So it's finding the mixture that works for you, looking for the sales, planning ahead, and not getting caught up in this narrative that everything has to be the highest level. All you have to do is you lower your carbohydrates, you make sure you're eating enough protein, you add fat for taste and extra calories if you need it. And the sources of those are sort of up to you. So if there's concern about budget, just Google Diet Doctor Keto on a Budget, and you'll find our guide, and it'll walk you through some of the details.
Thank you, Bret. Bret, next question is, should women do long periods of fasting?
So women and fasting is an interesting one. And this is, are you premenopausal or postmenopausal makes a difference, because women who are premenopausal, and especially if fertility is still a consideration, then long periods of fasting may be detrimental. Because if you think about what the body is thinking, if you want to give the body a brain and think about what the body is doing, when nutrients are not coming in, that can mean a sign of famine. The last thing the body wants to do in the sign of famine is get pregnant, because you're unlikely to do it. So it's not a famine, you're just choosing to not eat, but your body doesn't necessarily know the difference. So that can cause anovulation, it can cause amenorrhea, it can cause the inability to get pregnant. So long-term fasting in that setting might be more detrimental. Now, if you have PCOS, polycystic ovary syndrome, then low-carb diets with intermittent fasting can be beneficial to actually treat that and reverse that. So that's the one caveat. If you're postmenopausal, fertility is not a concern for you, you're not worried about menstrual periods, then longer-term fasting is probably no different between men and women. So it's more about what works for you individually more than your gender, unless you're concerned about fertility and menstrual periods.
Thank you, Bret. Next question is related to that. How to treat PCOS and PCOD?
Yeah. So PCOS, look, the biggest treatment is losing weight and doing it in a way that will lower your insulin levels and control your blood sugar. Pretty much anything that you can do to accomplish that is going to help PCOS. Now, low carb diets happen to be a very effective way to do that, right? They're very effective at helping you lose weight, lower your insulin, and we have a guide on that at Diet Doctor. There are a number of studies that show improvement in the hormonal regulation, that show improvement of the symptoms. And there's so many anecdotal reports of people improving their fertility with low-carb diets and PCOS. So it's definitely an effective way. Doesn't mean it's the only effective way, but it certainly is an effective way.
Thank you, Bret. Bret, next question is, can low carb reverse thyroid issues?
So low carb and thyroid issues is actually a tricky one, partly because any weight loss and any new diet can cause potentially thyroid issues. So it's something you just need to be aware of and monitor. There's nothing specific about low carb though that should impact thyroid. You need to make sure you're getting enough iodine, which as long as you're eating some seafood, and if you have table salt, then you're getting plenty of iodine. But one way it can help it is if it's a thyroiditis, a Hashimoto's thyroiditis, some sort of autoimmune thyroid condition. Low carb diets can be helpful for many people with autoimmune conditions. Again, not a cure-all, not going to work for everybody, but for some people it can be beneficial. So in that setting, it can help thyroid. There's also this concern about a decreased T4 to T3 conversion. So those are the sort of the thyroid hormones that have the effect. T3 is the main one that has the actual physiological effect, and your body converts T4 to T3. So there is some evidence that low carb and keto diets can decrease that conversion of T4 to T3. So one interpretation can be, oh no, we have lower T3, we're going to worsen our thyroid function. But actually, that doesn't play out. There's no increase in symptomatic hypothyroidism. So the question is, well, do we then have a greater sensitivity to T3? That's certainly possible. But the key is, are you more symptomatic? Is the whole picture of thyroid health decrease? And there's no evidence for that. Yeah.
Thank you, Bret. Bret, last question from subscribers. Can people who had heart surgery follow a low carb diet?
Yeah, and this is one I get a lot as a cardiologist. And what I can say is I treat a number of patients who have had heart surgery on a low carb diet. So I guess the better question is, well, why wouldn't you? What would be the thing to prevent you from doing it? And again, it's this concern that high fat is harmful for heart disease, which is not true as a general blanket statement. So let me rephrase it another way. If someone who had diabetes, type 2 diabetes, and was obese and had heart surgery, and they go on a low carb diet and reverse their type 2 diabetes and reverse their obesity, have you helped that person? Absolutely, you have helped that person. Now, the caveat being, what if your LDL goes up? That's really the only leftover concern, I think, with a keto diet, whether you're talking about primary or secondary prevention. What if your LDL goes up? So that's going to be much more of a concern in someone who's had heart surgery versus someone who's never had heart disease before. But my approach is you can deal with that. I mean, there are other ways to deal with that. And it doesn't happen in most people. That's the other thing. And most doctors think a keto diet equals high LDL, and that is absolutely not true. You look at the vast majority of the studies, the meta-analyses, and it shows on average, there's no change in LDL on average. Now, there's going to be some, different individual variation, but on average, there's no change. So if you put someone on a diet and you improve the size and density of their LDL, you lower their triglycerides, you raise their HDL, you reverse their diabetes, you help them, you're helping that person. So absolutely, someone who's had heart disease can start that kind of diet if that's their response. Now, if you have type 2 diabetes, if you've had heart disease or heart surgery, it's best if you do this under guidance of a physician. And that's where things can get tricky. So we're trying to engage more physicians at Diet Doctor. We have a free 3-hour CME course, continuing medical education course, for doctors to learn about using low carb as an intervention tool. We have a map on our website where you can go on the map and find doctors who are familiar with low carb, either in your area or who do telemedicine consults to help you. We're trying to make it easier for patients who want to engage in low carb and are having a hard time finding a doctor knowledgeable enough. We're trying to open up avenues for them to find people, because that is important. Certain populations are going to need more guidance. And like I said, anybody on blood sugar lowering medications, and I think anybody with established heart disease would do much better by having some professional guidance.
Thank you, Bret. Bret, last question. Would you like to issue a 7-day challenge to our subscribers?
Would I like to issue a 7-day challenge? Just like come up with a challenge for them?
Yes, Bret.
Well, okay, sure. Let me think about that for a second. I would like to issue 2 challenges. I guess
Awesome.
the first challenge would be to just cut out the sugar. Cut out the sugar sweetened beverages. Cut out anything that comes in a package that has sugar listed on it. If it's got any of that, get rid of it. And then the second challenge is go to Diet Doctor once a day to find substitutes for those. Because if you just get rid of it and don't replace it with anything, well then, you could be missing it. But go to Diet Doctor, look through our recipes, look through our information to find substitutes for that to help make it easier. Start with the 6 steps down the carb mountain to help you with that transition. You don't have to jump in right away, but over the course of 7 days, sort of slowly make improvements that will lead to a lifetime of success.
Thank you so much, Bret. Bret, thank you so much for coming to the show and helping us to become healthy.
My pleasure. Thanks for having me on. Subscribe to bnsgokugreat.